Let's talk about National Skincare Awareness Month. Let's talk about 3 different conditions. We'll talk about acne skincare, seborrheic dermatitis skincare, and eczema. Let's first start with acne. A very common retinoid that is in the stores is Adapalene, 0.1% gel, name brand different, but nowadays you can get generic Adapalene. A pea-sized amount should go on those acne-prone areas at bedtime. It should spread all over the forehead, cheeks. Avoid the creases, corners of the mouth, corners of the nose. We don't put retinoids there. It scales and peels too much there. Have the patient wash it off in the morning because it is photosensitive, of course. Seborrheic dermatitis, these scaly scalps and sort of these scaled, greasy erythematous scaly areas that happen around the nose, maybe in the ears, at the hairline, that can be treated with Nizoral 1% shampoo. That's basically ketoconazole 1% shampoo. They should rotate with selenium sulfide shampoo, salicylic acid shampoo, and maybe a tar-based shampoo. So Selsun Blue, Neutrogena T-Sal, maybe DHS tar shampoo or Neutrogena T-Gel shampoo. They should basically rotate through one different shampoo each night, letting that shampoo rest and lather in their hair, their face, their ears for 1 minute before they rinse it off. If your hair is drying out too much from ketoconazole shampoo, then you don't need to use it every night. Really, 2 to 3 times per week is usually adequate. Of course, you can use your regular shampoos in between. Lastly, with eczema or atopic dermatitis, we know that eczema season is coming up with the fall and the winter when the temperature drops. That's when eczema flares. We know that these patients do well if they were lube up their skin with emollients. So including CeraVe, amlactin, or products like Vanicream. These are all great lotions that should be applied not to dry skin, right after the shower to prevent a transepidermal water loss, which is really characteristic with eczema.